homeless youth during COVID-19. And we'll ask you to do a couple things as you enter the room. Would you enter your name, your agency, organ affiliation, and tribal affiliation in the chat box. And then we have a poll for you to complete. This pre-session poll is connected to some of the content we'll discuss today. We'd like to get your insight into these two items that are in the polling box. So we'd ask that you, again, enter your information in the chat box, your identity information, and complete the poll as you arrive. Thank you. Thank you once again. I hope you've had an opportunity to enter your information in the chat box and complete the poll. We're going to go ahead and close the poll and get started with today's presentation. Thank you. The National Council of Urban Indian Health is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V urban Indian organizations under the Indian Health Service Act in the Indian Healthcare Improvement Act. NCUIH strives to improve the health of the over 70% of American Indian and Alaska Native population that lives in urban areas supported by quality, accessible healthcare centers. Mr. Angel Galvez was born and raised in the Woodville labor camp. In the Woodville labor camp in California. His parents are indigenous to the Zapote Indian clan of Central Mexico. He has worked in the Indian health field with a vision of serving everyone with dignity and respect, starting as the chief operating officer for the Tool River Indian Health Clinic in the Tool River Reservation, and eventually serving as the CEO of the Bakersfield American Indian Health Project. Angel's impeccable background in finances, leadership, management, and development, his well-rounded experience in organizational oversight and accountability has prepared him to bring parity to the unserved and underserved population of Kern County. Angel earned a Master of Arts in Strategic and Organizational Leadership degree from Fresno Pacific University, as well as a Bachelor of Science degree in Criminology with an emphasis in victimology from Fresno State University. He's used his lived experience and education to develop and implement essential services for youth and adults, which include housing supports to address homelessness. Angel is married and they have 3 children, 2 daughters and a son. The family serves at their local church, are involved in youth sports and activities, and have served on nonprofit boards and is actively involved in the community. Ladies and gentlemen, I'm pleased to hand the baton to our guest presenter, Mr. Angel Galvez, and we'll get underway. Angel?
Thank you so much, Mark, for that kind introduction. Good morning to you all from the language of my parents to you. I just want to I'm deeply grateful for NCUIH and the team to really give me the honor to present to you a presentation on best practices for outreach and referrals for homeless youth during COVID-19. I just want to share a quick little side note. Mark had mentioned that I grew up in a labor camp. There's 5 labor camps in the county of Tulare, with Woodville being the second labor camp that was put to allow for the Bracero program to house farm workers coming from the country of Mexico. And so early on, that's how my father ended up coming to California to work in the field. And I grew up in this labor camp with a lot of people that looked like me. So I was really blind about, anything outside of the labor camp. However, I do want to mention that the Tool River Reservation, which is made up of predominantly Yoruba Indian Native Americans, was about an hour and a half drive from the labor camp. And for some reason or another, many of the folks that live in the labor... Hello?
Excuse me, Angel.
Yes.
There's some apparent difficulty with your audio, and it's not clear if your microphone setup is catching your voice very well. I don't know if you can adjust your headset or move the microphone closer to your mouth. People are describing the sound as garbled. So
Okay, how about now? Is it a little better or no?
I'm waiting to see feedback. I'm hearing it somewhat better. It's not apparently coming very well for everyone. A few folks
Okay.
said better. Again, I would just ask you to have the mic maybe as close to your mouth as possible.
Okay, I'll try to
And
do that. I'll try to do that. I'll speak a little louder, hopefully that
yeah,
helps
I
a little.
think that might help as well. Thank you.
Okay, not a problem. Thank you for letting me know. So as I mentioned, I think my introduction to the Native American culture started on very early on. There was a lot of people that lived up in the reservation that also worked in the fields during the late 70s, early 80s. And I had a lot of friends that were Native American, local Native Americans living up into the river. So I always had a connection or a nexus to the reservation. So I grew up learning their ways, learning their culture, learning their problems. And their problems were really not so much different than the problems faced in health disparities among indigenous folks of where my parents came from, as well as the Mexican Hispanic population. So having said that, again, I think I'm really pleased here to just offer you maybe some tips, and probably nothing different than what you're doing, but just some uniqueness as to how we have formed some best practices to really continue the outreach during COVID-19. Next slide, please. So just a little bit of how my style is really conversational. I'm really curious to hear what you have to say, and your input is really going to be important in this session. I'll pause after every slide during my presentation just to maybe answer some questions or just hear some comments. I think that's kind of the best way or at least the best way that I have found to really learn more, and that's really by engaging. So I'll be pausing through some of these slides to allow that platform to take place, because obviously time is limited, and at the end maybe you'll have a question that you wanted to ask and you just didn't get the opportunity to do so. So I want to make sure that we just do that during the time that we're presenting. One of the things that I have found in homelessness, and think of homelessness no different. I think in the United States, no matter where you're at, I believe you're probably seeing more homeless issues, more homelessness taking place in your community, whether it be in Washington, D.C. or Bakersfield, California, or at your doorstep from wherever you live. You probably have the very similar issues we're dealing with here at our location. To be honest, we chose to be at the heart of where homelessness exists. And there's reasons for that, because we really care about serving this population. And so our site, if you were to Google map it, you would see that there's people that probably literally sleep at our doorstep. Not necessarily here for us to open the door and provide them a service, but rather we're living among where they live. So some of the things that I have learned is that, most of the folks that are homeless have no connectedness to community. They lack some form of cultural identity. And so when we think about outreach and engagement, try to think about it with the lens of culture. And so one of the three P's that I sort of kind of use, and a model that I sort of spirit among the folks that I get the pleasure of serving with to outreach to homeless folks is, with COVID-19, is just being really preventing unsheltered homeless people from contracting COVID, protecting unsheltered homeless people by safely engaging with them and participating in this process. You guys are the change agents, you're the ambassadors, you're the advocates, you're the staff. I mean, you're here now. And so that's meaningful, that's important, because you obviously care about making a difference with regard to the topic that we're discussing today. Next slide, please. So just a quick couple polling questions. I'm just curious to see what you have to say in terms of these two questions. You know, do you think that social programs will help end homelessness among youth? And the second question is, do you feel you receive the necessary training to safely approach or engage with people who are homeless? So just a simple yes or no. And we'll take about a minute or so to capture those responses. So as we're waiting for those responses, just so that we don't lose time, you know, what are some of your thoughts? I mean, I know some of you are answering, and we'll kind of get to see what that response is, or at least what the poll will tell us in terms of percentages. But does anybody care to share, you know, kind of your view in terms of the polling question? Don't be shy.
I think everyone can simply unmute their mic from their own laptop. So you don't need to ask permission or raise your hand to have the moderator change your microphone setting.
I think that for number one, the social programs, I think I'm kind of in the middle. I don't think there'll ever be an end to homelessness, but I think we can drastically prevent the number of homeless people. Homeless youth.
Thank you for sharing. So, you know, as you can see, we have you know, about 77% who say yes, and we have, you know, on question number 2, we have really right down the middle, about 51% versus 49%. And so just to comment on you know, and echo what the speaker, or I mean, I'm sorry, what the person just said, is that, you know, social programs are not intended to end homelessness. Rather, they're intended to provide a strategy or some strategies to really support or to really serve solving issues within homelessness. I mean, this is just literally right down the street. This picture that you can see right next to the polling question is a picture that I took. I didn't take a picture of the gentleman that was sleeping right next to it, but right on the other side of that cart is someone who's sleeping on a very busy road right next to the freeway. And so it's probably a very similar picture of what you see in your community, because I'm sure that the result of homelessness really looks a little bit like what you're seeing here in this picture. And, you know, a week later, that's all gone. And so who's doing all of that? Who, you know, you have to ask yourself, in terms of social programs, is that being done by force, or is that being done by serving, by helping? So it's just interesting that sometimes you see these things and they're all gone, but they're somewhere else, right? The second question, which was sort of kind of split in the middle, was you know, the training. You know, a lot of folks feel like there's not enough training, or there is training, but they're not receiving the training. And so what do you do in terms of really training yourself up to feel confident that you can go out and outreach? What are some of those best practices that you can use to go out and serve some of the homeless individuals? Well, you know, NCUIH, COL, your local organizations, your county, your native community, perhaps nonprofits, NGOs, all of those folks, I'm sure, have a form of best practice that they can share in terms of how to doing this effectively. But, you know, we all have the CDC guidelines, we all have the PPE framework to effectively do that. And so it's important that you read that you share that with your staff, and that you perhaps even engage in conversations with your trainers or those who are providing training to really demonstrate how effectively to use PPE while you're out there engaging.
Angel, I just wanted to make the observation that Diane Yazzie Divine in the chat box noted that the combination of actual housing options from shelter to, and I'm not sure about the acronyms, RRH, permanent supported housing, I think is PSH, transitional, affordable, should be paired with comprehensive social services, and that's necessary for serving the homeless.
I agree. I think that's a great comment. One of the ways that that's being done at the local level, at least here in California, is there's at the county level with the Board of Supervisors, they're running a homeless task force that's made up of many of these stakeholders that were just mentioned. So I spent a couple of years on a task force myself, and of course, there's a lot of there's a lot of collaboration. There's a lot of stakeholders, so a lot of that work takes time to effect. But I agree. I think that's a great way of being able to tie in social programs with that method. Next slide, please. So, we continue this road with best practices. So what are some of the things that you could do? We're specifically emphasizing on, the best practices for engaging with youth. But when we talk about, in this platform, we're talking about really serving the Native American, Alaskan Native people, right? What can we do better that is perhaps already being done or not done, in your community? And one of the things that we as a team here at Bakersfield American Indian Health Project, one of the things that we decided to do is to really reduce or eliminate homelessness among our Native American, Alaskan Native people. And that's very complex because there's so many layers to this. Someone who becomes homeless has so many different types of layers that you probably already know. And I won't spend a whole lot of time on that. Just to say, say it's a Native youth who has, is being raised by someone other than their parent, and they have substance use, and they perhaps lack the support from either a Native network or any other type of network. They feel alone, they feel hopeless, they really don't have nowhere to go, doesn't really have the support system to care to really stay unsheltered. So they go off, they live in the streets. How do you really eliminate that? How do you really reduce that? And so here's a list of a few things that we felt here on ways that we can still engage in outreach without allowing COVID-19 to really restrict us from doing that. So, we created some policy. We created some procedures. We wrote these down. We ran these through our board. We checked in with the local health officers, and we formalized a process that would allow us to do this. And so when you do that, you get buy-in from all of these entities that have the authority to tell you, no, you can't do that. And so we work with these partners. We establish a relationship of trust. And so here's just a few ways that at every level that you can educate, because you need to become the change agent, not them for you, you for them, and saying that, hey, look, listen, we're a health organization. We've been funded with monies to lead the way in this whole COVID-19 pandemic, right? So use some of that COVID money to put on training, to teach them, to give them the resources. Here's gloves and here's masks, and we pass these out. We have a wellness bag that we created here, and we put hygiene kits in there. We put gloves in there. We put masks in there. We put native type materials, flyers, testing sites. So we took this framework and we said we have to have every single program available. If they call us and they say, hey, I'd like to test, we have somewhere that we can test you and provide those services. If they say, hey, I need a place to stay so that I can shower, so that I can clean up, so that I can sober up for a day or two, We have that. We have a contract with the local hotels to provide them a room and be able to provide them. And when they're there, we have all of our behavioral health team and medical team at their disposal to ensure that they get the best service possible. But we do that with a prevention framework. You know, we will maintain social distancing. We will wear our PPE when we're engaging with them, and we will educate them and tell them the reasons why we're dressed in this fashion and why we're treating them in this fashion. So, you know, one of the things that I enjoy saying is always, you got to get out of your office. You got to get out of your office. You can't just be in your office trying to solve homeless issues, because you're not going to be very effective. This is a really old picture of me out in the St. Johns River, because that several years back, there's a lot of controversy of the homeless living in the riverbeds, because that river was going to be filled with water, and they didn't want to listen. They didn't care. I don't care what the government or the county or whoever, this is all false. We've been in a dry spell for, 15 years. There's no way this river will ever fill up. And, we try to do so much effort to let them know, look, build your home on top of the river, because the water is coming. The water, they're going to release the reservoir up there. There's reasons why they're doing that. And some people were willing to listen, but we needed to be there to serve them as well and help them out. And so other ways that we scale up practice is by introducing cultural and spiritual and evidence-based programs that support you in this effort of providing the best practice for solving homeless issues. So most of you might be familiar with the White Bison training, the Hazelton curriculum. I won't get into all of the nuts and bolts of how all that works, but I just want to share with you that these resources also have best practices of how to engage the Native American community in a culturally and linguistically relevant way. And so those are just a few resources that you could perhaps include as part of that engagement process that we do. And tell your story. I can't tell you how critical that is, right? To really share your story and be genuine. I think the greatest way to really earn the trust of homeless individuals who perhaps when you come and they see you with the mask and wearing the gloves and you look like some scientist, who's trying to speak to this population, they're sort of out of the loop and they're clueless about this stuff. And so having all of those resources and just saying, hey, look, listen, here's my story. Here's where I came from. I might not have the same experience as you. I might not have lived homeless for 5 years, but I have struggled. I have this, I have that. And I just want to let you know that I care about making a difference. And that's why I'm here. And so I just want to leave you with this and reach out to me. And I didn't get permission to play. I was going to play a little sound bite of a homeless individual that called me about 2 months ago and left a message on my phone. And I tried calling him back, and he was a little skittish about saying, no, I don't want people to hear my message. But he reached out to me, called my personal level and said, Angel, I really need you to hold my hand. I need to get housing, brother. I need it now. I need it now. And I'm talking a relationship of 3 years. And so when they call you and they reach out to you, you need to drop whatever it is you're doing, and you need to be sure to deliver, right? So it took 3 years for this person from then to now. So it's not easy, is what I'm getting at. This kind of work is for the special people like you, people like I, and people that really care about this community. Yes.
Angel, I just
Yes.
wanted to make a few observations from the chat box. And Carlene Pacheco made the following observation: a few tribes in northern Nevada do not have anything to help the homeless. The Falun Paiute Shoshone tribe and the Walker River tribe are a few I know of. That was her comment. Also, I was going to say one other comment was an observation of gratitude. It's thank you for incorporating infection prevention control as a frame of practice. That is definitely a must regarding best practices.
Hey, that's great. So I enjoy hearing that kind of. I think the first issue where they don't have anything there for addressing the homeless issues. And we'll take a little pause here in terms of Q&A, and I'm just curious to know why. And let me just say this though. In order for change to happen, it has to start with you. In order for change to happen, it needs to start with you. So the way you create change in your community, if there's nothing out there, be the first to do it. Now that ain't gonna be easy because you're gonna be all alone. You're gonna feel like it's so frustrating because there's so much. Not one person can possibly make that change, right? But you know, if you're like the Martin Luther Kings of our day in homelessness, and you go out there and you just do it, I guarantee you people will pay attention. And I'm not just talking about people, general people like you and I. I'm talking about people in positions of authority and perhaps in positions of creating change. And so people love that kind of story. So I just wanted to plug that in there real quick because whoever made that comment, I think it needs to start with you. So we'll open up the platform here. We'll take a few minutes. I apologize. I was supposed to pause after every slide and I didn't do that for the first 3-4 slides. But if anyone else wants to jump in on the conversation.
Well, I covered the.
Thank you, Angel. I appreciate you sharing the story about the homeless person that you've been working with for over 3 years and how that work is hard. And it's just about the right timing, right? You never know when someone happens to be in a circumstance like that. And I guess one of my colleagues brought this up, but there was someone who reached out to NCUIH in Washington State who became homeless for the first time in 61 years. And so with a lot of trauma and a lot of struggles, but they have been trying to find a place for housing, and they're native and they didn't know what to do since it was the first time. But I think being able to reach out to us and then connecting them with a lot of resources and places that they've never heard of that are focused on native, by native folks, for native folks to get them housing, gave this person hope, which she did not feel that way before the call. And yeah, I think it's good that people need to do this on a constant basis. You never know what's happening, but always being there to be that support and dropping, like you said, everything you got to help someone.
Yeah, I agree. It's, you know, well said. Well said. I mean, that's really what it takes. And they have a strong network. I just want to tell you, homeless individuals, when they start seeing you over and over and over and over and over, they share that among everybody. And then they say, man, you could trust. We have a brother in our church that if you go to Tulare and you say Jesse Munoz in the homeless population, that guy is famous among the homeless individuals. Jesse Munoz, who used to be homeless, who used to spend most of his life in prison, who, you know, was addicted to meth and heroin. His story of really winning with life and surviving all of that and just sort of coming out of homelessness and then giving back to that community in the way he does, I mean, it's made him a very popular man. And he's very humble, and he, you know, his struggle is still very real, but that resonates well with some of these folks. And so you don't have to have Jesse's stories or Jesse's life experience to make change. I think you just have to have the passion to get out there, let them become familiar with you. And when that call comes and when they say, hey, can you help me out? You said you had this and you had that, you better make it happen. And so that's kind of how we approach it here. We approach it from, if we say we're going to do something, we better have that service available. Otherwise, let's not say we can do this and we can do that. So well said. Anyone else? Okay, so next slide. So I do want to say this because I think we're so compassionate about about serving this population, and that I don't want people to really mix compassion. Don't compromise compassion for risk. And like my brother Jesse, who goes out there, and I spent a lot of time educating the church on a lot of this PPE stuff, because they were clueless. They just don't come from the health side of it. And so we began to let them know, why it's important for this. And here's the information from the CDC or from the NCUIH or from all of those HHS leading the way on COVID, and educating our nonprofits and our community about what this is all about. And reducing the risk really was the reason behind it. Yes, we know you still want to go out there. Yes, we know you still want to gather, but you have to do it safely. Your compassion is there, but you have to. Right now, these are the realities of COVID-19. And at first, I'm sure in your own communities, the perception was, this is no big deal, until it hits you personally and you lose a loved one, right? Until that happens, then it's a whole different opinion. Then it's a whole different perception. So everyone is at risk, is what I'm saying. And I'm sure you know that, but you're in the health field. You're following all of the guidelines. You're following all of the news, all of the information. But there's so much more people outside of our profession that are not. And so I think we need to take the responsibility and be leading the way by informing our communities on what they could do to really reduce the risk. It was funny, when I came onto this organization, everybody was shutting down. Everybody was saying, we have to work remotely, and we can't come to the office no more. And we have to stop doing all of this going out and face-to-face contact, right? And I said, I respected that. But I said, well, we're not going to close down. We're not going to stop doing what we're doing. We're just going to have to do it in a different way. We better work on that right now. And so, we were very strategic. We were very careful, but we spent a lot of effort putting it all in policy and procedure and standardizing how we will remain open, how we will deal with the 6 feet or getting more space and separating teams that were working together in cubicles. So you have to really think about it from, how can we reduce ultimate risk and continue to do what we've been doing all along, because people will suffer if we stop. And that was really the drive behind it. If we stop, people will suffer more so than if we don't. So, I mentioned don't compromise safety over passion. And, you got to really listen. I can't stress that enough. I mean, I know it's a funny story with the CEO title. I'm in a position of perhaps authority and decision-making, but really my title is really just to serve. That's really what it is, to serve everyone in the best possible way and listen to the team. Listen to those who know it perhaps better than we or than I. And so learn from that and leverage. I can't tell you how much I leverage everyone. I'm asking everyone in my network to have a little stake in the game. Don't just say you're going to help me out. I want a little stake in the game. And that's the only way we'll partner. That's the only way we'll collaborate. Yes.
But speaking of a stake in the game, a few observations from the chat box are right on point for that. One observation by Zep Fuller is, I think we're also living in a grassroots boom, and so many people who want to help have truly stepped up, and those without jobs have found a calling to start up.
Yeah, that's great. I think that's the way to do it. I mean, we don't have a very large youth network, but we're building that. That fell apart when the pandemic hit. It just really hurt that process of the network that we had built. But who better than to really be the next generation that really takes this on is our youth, our young adults, transitional age youth. Those folks that we are seeing in high numbers being homeless, they should be the voice. They should be the ones educating us on what to do or what not to do. And the way you capture that voice is by simply surveying them. So, as you're engaging and as you're going out, have a little survey available to say, hey, what works best? You know, what do you want to see happen, this, that, and the other, right?
Right. One observation from Ashley Alcaraz is that in my own neighborhood, I had a homeless individual living in the large tree bush and would not bother anyone. Would provide this small community of people. It was not on their property. It truly was unfortunate.
Yes, it is. It is. Great feedback. Great feedback. Anything else in the comment box?
I was looking at that. I thought I'd seen an additional message.
So to add to that, so I was providing food, blankets, and water to the individuals, and this week I had noticed that they're all cut down, and these trees were big trees, giant trees, and they're just all gone because they didn't want the aesthetic of homeless individuals living there, but you would never know they were there because there's a wall, and you would actually have to be engaging with them. And then also with my ASU cohort, we're trying to start a community fridge. So people in the community can go put food in there so that anyone, regardless if you're homeless or not, can go and grab what they need and put what they have. So that's something that we're working on in my own ASU cohort for our master's program.
Yeah, that's great, Ashley. Great feedback. Anyone else?
I think that's really good. I think that's really great, Ashley. And I think I used to live in Berkeley, up Northern California, in Berkeley, California, and I think it really depends on where you live and how the environment and how people around you are like to help with homelessness. I remember, man, there was in front of the city council of Berkeley, there was like 50, 60 tents for like 40, like 3 months at a time during winter, where they allowed homeless people to sleep like right in front of, governmental buildings and stuff, and gave them solar energy stuff to like charge their phones. And so it was nice to see that, that type of compassion needs to happen more often, because, how do you fill a housing crisis, right, where there's not enough people to get into homes? You got to give some alternative way for them to find some peace. And so that's all I wanted to add, but thank you for sharing. Go ahead, Angel, sorry.
Yeah, no, you bet. No, that's really good. I'm very familiar. I mean, all through up and down the state of California. I mean, Northern California has a tremendous, Southern California, Northern California, LA, San Francisco, Oakland, those big, huge cities. I mean, there are villages of homeless individuals that have created their own town, right? And so there's just so many issues that these homeless individuals suffer with. And according, we've done kind of our own research. I will say this, there's this perception of about roughly 33%, so it's like in thirds, 33% of individuals who are homeless want to be homeless, meaning they will agree that the habit of becoming homeless or the habit of homelessness has become the reality. In other words, I've been homeless for 10 years. I have a cousin who's homeless for 10 years. He lives in Porterville, in the riverbeds of Porterville. And he lost, his reason was he lost his 18-year-old daughter. My cousin lost his 18-year-old daughter to a local disease called the Valley Fever. Wow. Here in the Valley. She passed away, broke up the family. He got into alcohol and drugs. And I'm talking about a couple who were together for over 10 years with 5 kids. Life was good, both of them working really well. And this tragedy happened in their life. He's still homeless. And I run into him every now and then because I talk to my uncle and my other cousins, and he comes from a big family. And he has said it. Hey, look, listen, I like this life. I don't need a house. I don't need this. I don't need that. I just want to drink and this and that. And so 33% of individuals probably fit that description. That doesn't mean that mentality or that thinking can change at a later point. That just means that that's where they're at right then and there. And so I spend I spend less time with those individuals, more so the 1/3% that are fresh homeless. They've kind of gone back and forth. Those are the folks that I think have a chance to with the right resources, the right connections, can come out of that homeless state and not perpetuate a habit for a long period of time that gets perpetuated with those who are homeless for 5 years and over. So I just wanted to make that point real quick before I move on, because I think, go ahead.
I was just going to make the observation in the chat box. Scott James asked that you speak to how homelessness can be generational, and especially when you couple that with drugs and alcohol. One other observation from Caroline Ramos, it's here in Fairbanks, even when it is 40 below, we have homeless in tent camps. We have a few warming tents, but nowhere near enough for the homeless population.
Okay, so two things. On the first part, the generational piece. I think the generational piece really comes more from poverty than it comes from homelessness. In other words, the fact that you come from a generation of poverty, like the fact that I came from a generation of poverty, that mentality of poverty is really what I think most folks, because you can't compete, you know, when in Oakland, I can say that if I lived in Oakland, I come from a generational state of poverty, and when the prices skyrocketed and I'm challenged with really affording to live, then I have no other option, right? Like, I can't provide for my family, I can't provide for my for housing, and so what do I resort to? The easy way. The easy way is to just give up. The easy way is to just say, well, shoot, it's too much. I can't afford here, I can't afford there. I need to figure something out, but you really, it pushes you into that. And that's the responsibility of that community or the community leaders, I should say, whether it be the county, the state, whatever. And so I just want to make that comment about that I think you need to break the generational of poverty in order to break the generation of homelessness. To the second point, you're right. I think that the housing, you know, people live in tents, on the floor, on cardboard boxes. There's a big movement for tiny housing. However, every community, in my community, about 4 years ago, they're barely doing it now, but about 4 years ago, I went to the Board of Supervisors and I got in front of them and I said, hey, listen, I have a friend who's Indian from the Middle East, owns a hotel with 60 beds, and no one rents from him. No one, these beds are all empty. And it's an older building, you know, it's like a 1960s motel that, you know, got competition, others built around it, little nicer motels. And he don't care. He don't care if anybody rents it. It's just, that's what he does for a living. He has it as an investment, and he can care less if there's 5 people there or 60 people there renting the motel, right? This is a good friend of mine. I've talked to him. He's willing to be part of the solution. All he's asking for is a stipend of like $20 a night to house homeless individuals. I worked it all out. And you know what? It fell on dead ears. Nobody was willing to support it.
Wow.
So, and but it didn't fall on dead ears. It fell on dead ears then. But finally, they just purchased one, not from my friend, but they went ahead and moved forward, because why try to build all this other infrastructure when you already have it all there? He had 68 beds ready to go. They weren't in the best conditions, but they had running water, a toilet. It was reasonable to put a homeless individual there, and the county supported with some type of program. And, you know, they were trying to work all the money, where the money's going to come. And, you know, and I get that and I understand that, but the problem is that for 4 years, these folks have been suffering and dying of cold, of heat. You know, we have a tremendous heat wave that hits us here in the summer. It gets up to 110. And the cold is not as cold as perhaps from the parts where you all live, but that was the whole reasoning behind it. Like, hey, put them in a comfortable space during the worst climate conditions. That was the whole pitch that I had done, but, you know, thankfully now they're doing it. So you got to keep pushing the message. I mean, you just can't give up. Things do happen eventually.
Angel, I wanted to make the observation. There's two things. There are a couple of comments in the chat box, but I also wanted to alert everyone. We're about 10 minutes remaining. I've just entered a link in the chat box that we'd love you to reflect on the quality of today's presentation, other information about your satisfaction and so forth with a survey, online survey. Just if you click the link and go to the online survey at the end of our presentation in a few minutes, I really will appreciate that. Then finally, just to get back to some observations made in the chat, it's that the things have been happening in Flagstaff, Arizona as well, and they've lost community members to the cold. So that that outdoor sheltering concern is a real challenge. The other observation was, again, congratulating Ashley on the efforts made to address homelessness in her community. The native NAC, I'm sorry, but Diane Yazzie UIO operates a 25-bed no barrier shelter for homeless youth ages 18 to 24 years old in a dormitory style congregate living shelter. And as new youth enter, they receive, and I lost the, as new youth enter, they receive, I'm sorry, I can't see that the last bit of that statement. Diane, you can unmute your microphone.
Sure. Thank you, Mark. So as youth enter the shelter, they actually receive a rapid COVID test. And if they're negative, they immediately enter the shelter. And then we follow up with the PCR test. And as of January 12th, the youth can now voluntarily receive the Moderna vaccine because of the congregate living situation. The average length of stay in the shelter is 78 days, although it's been longer during COVID. And right adjacent to the shelter, we operate a 24 studio unit transitional housing program called Sora Key for employed youth or foster care youth with foster care vouchers or rapid rehousing vouchers up to 18 months. So I was just offering a resource that's available.
Thank you, Diana. That's what the RRH stands for. Now I get to thank you so much. I appreciate that input. Again, the stories are really powerful. I can't help but react to the phrase that Angel used about the habit of homelessness and how that speaks to a culture, if you will, of how you hand down a way of living or how you adopt a way of living that becomes so ingrained into you that it feels like a habit. I think that really is very powerful. And now that is pretty much everything that's been in the chat room so far, Angel.
So thank you so much, Mark. I know the time is short. I'm gonna run through these next few slides. So I want to conclude by saying, you know, all this hard work that you all do, in our case, what's the result, right? What's the result? What's the impact? And so I just want to share with you those true leaders that have persevered through homelessness. So the images and the stories you'll read for yourself. I'll just make a few comments about them. But you know, we certainly have had our wins with our local community, those who are native local to Bakersfield. So next slide, please. So here's the faces of change. You know, Mr. Jeffrey Hayes, you can Google him. He's a Native American living here in the Kern County, in the Bakersfield area. I give credit and kudos to our drug and alcohol counselor, Ms. Donna Cubitt. We truly are very blessed to have staff that really share the same passion. And so when you're recruiting, I mean, it doesn't have to be a staff member. It could be a volunteer. It could be an ambassador. It could be somebody from the community. You really need to recruit the right team. And I think with the right people, you can address these issues in a way that is more community defined, right? A one size fits all approach is not going to happen. If you're homeless in Hawaii, well, that's not going to look the same if you're homeless in Washington, D.C. or in Idaho or in Nebraska, right? It's not going to, Hawaii is probably not going to really worry about sheltering, but they should worry about other issues because the weather is favorable. So Jeffrey Hayes, Awesome guy, was homeless for quite some time, resorted to drugs and alcohol. His story is very amazing. We, well, when I say we, I'm just meaning Bakersfield American Indian Health Project, heard, listened, and said, you know, we'll help you out in this journey. We'll support you. We'll provide. What do you need? Hey, I'm into exercising and weights. Well, let's get you a membership. Let's start there. Why don't you go to a gym on your own time, on your own pace, and I'll check in with you over there, rather than come to my office and hear me out on all of the resources I have. Let's meet them where they're at. Let's get out of this office and begin to care about what it's important for them. So very proud of Jeffrey. He recently got married a year ago, met someone, got married. He's just doing phenomenal. So is it possible to go from a state of hopelessness, living homeless, to journeying back to being a productive member of society, having self-worth, connectedness to your community, your identity, being proud of you being native and not fitting in with that, you know, generational curse, if you will, of or the habit of homelessness? Yes, it is. You know, he's an amazing story, an amazing example of that. Next slide, please. Here's another person. He's became a national icon. He's from the Tejon Indian tribe here in Kern County. Was homeless as well. He was struggling. Like many with the pandemic, was stressed out. The business had to close. His situation wasn't related to the pandemic, but his experiences in the very same way. His business, he couldn't handle it. He was trying to launch it, was suffering. Income wasn't coming in, was numbing himself with drugs and alcohol because he couldn't take the pressure. And eventually everything folded. He just gave up. I said, I don't need this. I'm just going to be on my own. And so it all started with like the outreach. And hey, I'm referring to Donna, our counselor. Hey, I understand. I'm Native as well. I have members of my own family that have that same experience. I just want to be able to reach you. Well, I need a bike. That's how it started. I need a bike. You want me to go see you somewhere? I need to get around, right? It all started with a bike. And look where he's at. Look what he's doing. He took passion to becoming a cyclist. They call him Fast Frankie. Who would have ever thought that Fast Frankie, who was homeless, could be that fast? I mean, that's really how simple it is. You just have to meet them where they're at, do it safely, learn how to do it, and then do it again. Everybody's very unique. For one, it was weightlifting. For the other one, it's biking. For the other one, it might be sweat lodging. It might be art. It might be this. It might be that. But you have to have the resources. You have to be willing to just say, okay, if that helps your healing, let's do it. If that's how you define healing, let's do it. Let's have no barriers, no gaps. So I just wanted, next slide, please. So there's Donna, our champion. The gentleman in the middle, he's our advocate for. This man is everywhere. Like, hey, you need sweat lodging, I got you. You need this from BHP, I got you. He doesn't work for us. He doesn't get paid by us. He just wants to be a Chinese Native American himself. He just wants to be a change agent. That's his passion. That's what he wants to do. We buy into his mission and his vision. That's Donna on the right. She's our substance use disorder counselor, has impacted so many people. Without her, I'd be nothing, to be honest with you. Without my team, I'd be nothing. And I just want to end with that I'm really grateful and thankful for being on and giving this opportunity to really present to you about best practices. Thank you. Next slide.
Thank you, Angel. We appreciate that presentation, an inspiring presentation, and folks in our chat box have said as much. As Manchester says, Ahial, Ahihihi, all. Thank you so much for participating and attending our session today. Thank you for all you do in our communities, and have a great week. And I want to add my own commendation to our participants, and thank you so much as well, Angel. I think we have a few more closing slides. Again, I would encourage you to please go to our link and complete the survey at the end of the session. We have our polls, I believe. A closing. There we go. This post-webinar poll. I ask you to, those of you who remain, please take a moment to complete the poll for the post-webinar. Again, the items, you've seen them before. So we ask that you complete the poll real quickly before you leave us today. Take a few moments. Again, I want to thank everyone for your patience. We've gone 3 minutes over our allotted time. I want to thank you for your participation and your commentary. I think we had a really engaging conversation this afternoon. I ask that you complete the 2 items in our post-webinar poll. And when you leave us, please click on the link and visit the SurveyMonkey session evaluation. So we'll be able to record your observations about today's session. In the chat box, there is a response. Yes, there needs to be more compassion and innovative ways of collaborating with local motels, tiny homes, and providing a warming tents. That observation was from Sabu to everyone. Take a few moments to complete our post-webinar poll. I want to also alert you to our upcoming event on January 27th. Part of our mental wellness series features a workshop, Beyond Tolerance and Overcoming Barriers to Care, for LGBTQ and Two-Spirit youth during the COVID lockdown. I'd encourage you to please visit our mental wellness series. Not only will it be an active and engaging conversation, we also have access to the via a landing page to the previous sessions of the mental wellness series, as well as access to the slides as a PowerPoint or PDF being available on the NCUIH homepage for today's session. I want to thank everyone for their kind observations on the way out. Again, thank you for your participation. If you'll complete the poll and visit the SurveyMonkey link, I genuinely will appreciate hearing from you. Once again, I want to acknowledge Angel Galvez presentation and thank him from the bottom of our hearts here at NCUIH for sharing with our audience today.
You're very welcome. Thank you, everyone. I appreciate your time and your dedication, your commitment to being here at this space and also the work. Thank you.
Thank you so much, Angel. And we really appreciate your sharing from your expertise and depth of experience with our audience of practitioners and participants and supporters, not only for equity, but for homelessness and housing insecurity challenges.